Welcome back to the channel. Should presidential candidates report their physical examinations or even a cognitive test? That's been the topic of some recent opinion articles in the New York Times. It's called 14 Questions About Our Leaders' Health. It's an opinion article by a physician and professor of psychiatry at Columbia University. And the author has 14 questions for, at that time, the three people they thought might be candidates: Donald Trump, Joe Biden, and Kamala Harris. Now, of course, we know it's Trump and Harris. That's going to be the election. These are questions about their health. And this is a perennial question. It happens every election cycle. Should these candidates be providing information about their health? I think the answer is absolutely not. Any information they provide about their health will be misused and misinterpreted by people who already want to vote for one person or the other for political reasons. And it's going to be twisted. And in fact, there is probably almost no one who's going to be, should I go this way or that way? And the deciding factor will be his LDL cholesterol or her LDL cholesterol. That doesn't make a lot of sense for a couple of reasons. All right, so let's start with the big reason it makes no sense. If something happens to the president, the person who's going to take over that role is the vice president. Whomever Kamala Harris picks as the vice president, that person is going to be more aligned with her on political issues, on decision making, and the types of issues that voters care about than the opponent, okay? And whoever Donald Trump picked, which is J.D. Vance, he's more aligned with Donald Trump on political issues than Kamala Harris. So if something were to happen to the president, no matter who it is, their next in line successor is going to be more likely to carry out their policies than the opponent. So it would be illogical for you to try to pick one or the other based on their health. That's number one. Number two, you can know all these details about someone's health and you can make an actuarial or statistical guess about their survival. But for two individual people, you really can't be sure who's going to live and who's not going to live, who's going to be the first to go. It's much more random than you think, okay? Now, insurance companies take this information and then they provide different rates of insurance to different people because they're budgeting their premiums. They want to make sure they still make money. They want to account for the fact that, somebody who's older has a shorter life expectancy, so life insurance might cost more than someone younger, et cetera, et cetera. That's done at a population level. That's not done with two individuals where you're betting on their health. One, I think it would be silly to use their health to decide which one embodies the political beliefs and values that you champion. But two, I think that even if you sought to do it, you might get it wrong a bunch of times. So let's go through these 14 questions, and then let me talk about how I think they're stupid and why I think this is really sort of the weaponization of medicine. It's where doctors just want to weaponize medical tests to escape the hard political choices we have to make. So this is question number one for Donald Trump. Has Mr. Trump taken any cognitive tests in the last 6 years? If so, which ones? What were the results? Okay, Donald Trump's behavior has been pretty consistent. I think even his critics must agree he's acting the same as he's always acted, okay? His proponents believe he's acting the same, and his critics believe he's acting the same. So why do you think he needs to have a cognitive test? Do you think a cognitive test is going to change his views on immigration? Is a cognitive test going to change his views on inflation, on tariffs, on the war in the Ukraine? He's made his position very clear on these issues and what he's going to do about those issues. A cognitive test is not going to change any of those things. Number two, did the assassination attempt affect Mr. Trump's medical or mental health status? If so, how? A bullet grazes the ear and you want to know if it affects his mental health. Well, might have scared the shit out of him, but other than that, I don't think it's affected his medical health. They write, quote, the physician arranged for a precautionary CT scan of the head, but the results have not been released. Such secrecy can lead the public to wonder whether he's hiding something. Well, what do you think he's hiding something? You think he's hiding a subdural hematoma? He's hiding some brain hemorrhage? He's hiding some intracranial catastrophe? Is he hiding that? He would be getting neurosurgery if he had any of those things going on. His behavior might be different, but his behavior is exactly the same before as it was after. His speech after was in the same tempo and tenor as the speeches before. Nothing changed. You don't need to see his head CT, okay? You only want to see his head CT in the hopes you might find something that you can talk about endlessly on your empty political talk shows. What is his weight and cholesterol? You have eyes, you know what he looks like. What do you care what his weight and cholesterol is? You know his age, you know he's a man, you can make some guesses about his cholesterol, you get to make a guess about his life expectancy. Are you really going to vote for him if he was 10 pounds lighter or 10 pounds heavier? So irrelevant. What medications is he taking? Oh, he's taking baby aspirin. The physician reported he's taking a baby aspirin to reduce the risk of heart attack. Well, that physician should read the more recent randomized controlled trials. Antibiotics for rosacea, a statin for high cholesterol. Oh boy, what medicines is he taking? Who cares? It's irrelevant, okay? His policy is not going to be shaped by any of the medicines he might or might not be taking. Oh, this is the best one. Number 5. Do his basic laboratory tests reveal any significant abnormalities? Oh, you think he's got a potassium at 3.6 and that changes your vote, huh? Oh my goodness. If his potassium is below 3.5, I don't know if I'm going to vote for him. This is the dumbest thing I've ever seen. If he has beta thalassemia trait, are you going to change your vote for him? No. Basic laboratory values is not going to tell you if somebody's going to get pancreas cancer in 6 months. It's not going to tell you if someone's going to have a heart attack in a year. These are probabilistic population level things. It's almost impossible to tell the person in your office what's going to happen to them. Most people who die of sudden cardiac death, they didn't see it coming, and getting an LDL cholesterol a few months before wasn't going to clue them in or avert that outcome. Let's do the Kamala Harris one. For Vice President Harris, the New York Times opinion writer asks, has she had an annual checkup? If so, how recently? Oh my goodness. She's the Vice President of the United States. Are you stupid? Do you think she didn't have an annual checkup? Of course she's getting an annual checkup. Of course the people in the premier positions in politics are getting annual checkups, okay? I'm sure she's getting an annual checkup. Now, a smart person might ask, if you take a healthy middle-aged person and do an annual checkup to actually improve their outcomes, and I think we have a Cochrane review on the topic that shows you don't, so it would be pointless if you were doing it, but I'm sure she's doing it, okay? Of course she's doing it. All these political people are doing things that probably regular people shouldn't be doing, like getting coronary artery calcium scans and all unnecessary blood tests that somebody thinks is useful. Some, bad concierge doctor that they're seeing. Does she see a physician regularly? Is she getting an annual checkup? Now you want to see her every 3 months? Why would she be needing to see a physician regularly? Is that going to change your vote? Now you agree with Donald Trump's immigration policy if she didn't get her Q3 month check-in with the doctor? What sense does this make? Does she have any major medical problems? Who cares? Her successor, if anything were to happen to her, is much more likely to fulfill her policy than the opposing party. Does she take any medicines? Oh gosh. This knowledge could show any serious conditions she might have. You don't need to know any of this information, okay? And then the final thing, does her basic laboratory test show anything abnormal? Oh, what if she had beta thal trait? What if she has a high potassium? What if it was too high? What if her creatinine was spurious one day? Oh my goodness, what would we do? You don't need any of this information. I really struggle to believe that there is actually a doctor who thinks that any of this information should change how you vote because their political stances are very different. How could you possibly use this information to help make that decision? It literally makes no sense at all. It's the most illogical thing. And when I think about it that way, I can only assume the purpose of writing these articles is to go dredging, hoping to find something that you can use as a bludgeon against the political candidate you don't like. Why not force them to undergo unnecessary MRIs? Because the older you get, the bigger you are, the more likely you are to find some incidentalloma, and you can bludgeon them with that. I think this is an abuse of medicine. Just like I did all those videos on Biden's mental health where I accurately described that he wasn't operating at NBA level, and you don't need to label a medical diagnosis to know he wasn't operating at NBA level, and accordingly, he was pushed out, and there's lots of inside stories about how that happened. He was pushed out of the election and forced to withdraw without having to declare a medical diagnosis. You don't need that, okay? You can decide if somebody is a good thinker, if they make sound policy decisions, if they're good at bluffing, if they're good at international diplomacy, from their past behavior on the topic. Both these people have been in politics for some time. 2, how they answer questions in town halls. If we actually were to have more of those, that would be great. You can learn a lot from listening to the direct evidence of them talking. These kinds of misuse of medical tests to help to tell the public that information should go into how they vote, that is a misuse of medicine and a perversion of medicine, subordinating medicine to petty politics. And so I actually have no respect for Robert Kiltzman, a professor of psychiatry. I mean, my most sympathetic view is he doesn't understand that these tests can't tell you at an individual level who's going to live and who's going to die, and certainly can't tell you who's going to vote for. And I have no sympathy for all the people who keep talking about these things. I'm pretty confident there's not a single person who either agrees with Donald Trump or disagrees with Donald Trump who's going to change their vote if they knew what his cognitive test scores are, okay? They either like the way he talks or don't like the way he talks. They don't need to know that test result. So, 14 questions about our leaders' health. It should be 14 questions about their political views and political stances, because that's how you should make votes, okay? You shouldn't be using these crude proxies of their health that we really don't really know what to do with in many cases. So, if you like this is an impartial opinion on this topic, and I think it's demonstrably right. If you like this video, you know what to do. Like, subscribe, comment, leave a message below. My last video was about vaccines, a new study in Nature Communications that was pretty crappy. My new video is going to be about trust in physicians. I see there's a new poll that shows how that's really bottomed out. And to me, the only problem with that is that it didn't go even lower. It should actually be bottomed out even further after what all happened in the pandemic year. So we're going to come back and talk about that in a future video. So, like, subscribe, comment, send this video to a friend. And the last thing I'd say is whenever I make a video on COVID-19 or something like that, at the bottom, it links to Wikipedia. Now, I don't know why YouTube wants to link to the garbage on Wikipedia. Wikipedia has distorted many pandemic topics because the people on Wikipedia, who are the king wikis and they know all the stupid wiki rules, are devout COVIDians. They're insane people who were wrong about school closure, wrong about masking kids, wrong about lockdown, and they've hijacked Wikipedia, and they have, I think, smeared many legitimate scientists and scientific debate in those pages, and yet YouTube links to that. But I guess it's a step above linking to the CDC, which is an incompetent agency run incompetently for the last 4 years. So I don't know what to think. It shouldn't link to anything because this appeal to authority is, I think, mistaken. Anyway, those are my thoughts on that. So until next time.